Gentlemen, let's be real for a moment. As we get into our 60s, 70s, and beyond, staying intimate and connected is one of the joys of life. But have you ever stopped to think about the potential risks that come with oral sex at our age? According to the CDC, STI rates among adults over 65 have more than doubled in the last decade, and oral sex can play a bigger role than you might realize. It's not about scaring you. It's about empowering you with knowledge so you can enjoy those moments safely. Hi, I'm Dr. Larrisa, a urologist with over 11 years of experience specializing in men's sexual health right here in the U.S. I've helped countless gentlemen from Texas to New York navigate these topics with confidence and without judgment. Today, I'm diving into the hidden risks of oral sex after 65 and sharing simple, practical ways to protect yourself. We'll cover science from trusted sources like the Mayo Clinic and Harvard Health, plus real stories from my patients. By the end, you'll have a clear plan to stay healthy and vibrant. Quick question to get us started. Comment below where you're watching from and your age, like Ohio, 75. It helps build our community of strong, informed men. All right, let's jump in. Now, for the main part. Let's break down the top 5 risks of oral sex in men over 65, and for each one. I'll explain why it happens biologically, how it affects you emotionally, and practical steps to avoid it. Think of your body like a classic car. It still runs great, but it needs a bit more maintenance to handle the road ahead. We'll use a list format to keep it straightforward and easy to follow. Risk number 1, increased chance of STIs, like herpes and gonorrhea. Biologically, as we age, our immune system isn't as robust. Studies from the National Institute on Aging show that testosterone dips can weaken our defenses, making it easier for infections to take hold. The CDC reports that gonorrhea cases in seniors have risen 164% since 2009, often transmitted orally without symptoms at first. Emotionally, this can lead to anxiety or embarrassment, but remember, it's common and treatable. No need for shame. Practically, get tested regularly. The USPSTF recommends annual STI screenings for sexually active adults over 65. Use dental dams or condoms during oral sex to create a barrier. One of my patients, a 67-year-old from Florida, caught gonorrhea early through routine testing and cleared it up with antibiotics. He's back to enjoying life without worry. Risk number 2, HPV and oral cancer risks. HPV, the human papillomavirus, is sneaky. It spreads through skin-to-skin contact, including oral sex. The American Cancer Society notes that HPV-related throat cancers have surged in men over 60, with risks up to 5 times higher if you've had multiple partners. Biologically, aging tissues in the mouth and throat are more vulnerable to viral changes that can lead to cancer over time. Emotionally, the fear of cancer can be overwhelming, but early detection changes everything. Practically, get the HPV vaccine if you're under 45, or discuss with your doc if older. New guidelines from the FDA allow it up to 45, but off-label use is common. Quit smoking if you do, as it amplifies risks, and opt for regular dental checkups where they can spot early signs. A 72-year-old patient in California told me, "I got vaccinated late, but it's given me peace of mind. No regrets." Risk number 3, bacterial infections from poor oral health. Many of us over 65 deal with dry mouth or gum issues from meds or age. Mayo Clinic research shows this makes the mouth a breeding ground for bacteria, which can transfer during oral sex and cause infections in the genital area, or vice versa. Biologically, reduced saliva flow, xerostomia, affects up to 30% of seniors, per Harvard Health. Emotionally, it might make you self-conscious about intimacy. Practically, stay hydrated, use alcohol-free mouthwash daily, and brush floss before activities. If you have dentures, clean them thoroughly. Simple habits like this helped a 69-year-old from Ohio avoid a nasty infection. He said it boosted his confidence tenfold. Risk number 4, weakened immune response, leading to asymptomatic spread. Our bodies change. A study in the Journal of the American Geriatric Society found that men over 65 are more likely to carry STIs without symptoms, spreading them unknowingly during oral sex. Biologically, Lower white blood cell activity means infections linger. Emotionally, the guilt of potentially harming a partner can be tough. Practically communicate openly with partners about testing. Make it a joint habit. Use protection consistently. And consider PrEP if you're at higher risk. Talk to your doctor. One gentleman in his 80s from New York shared, "Open talks saved my relationship. We're both healthier now." Risk number 5. Medication interactions and side effects. Many of us take meds for blood pressure or prostate issues, which can dry out mucous membranes and increase infection risks during oral activities. Biologically, drugs like beta blockers reduce natural lubrication. Emotionally, it can frustrate your sense of vitality. Practically, review meds with your urologist. Switches like from one BP med to another can help. Stay lubricated with water-based products safe for oral use. A 65-year-old patient from Texas adjusted his regimen and reported fewer issues, small changes, big results. To wrap it up, gentlemen, oral sex after 65 can be wonderful, but awareness of these risks, from STIs to cancer vulnerabilities, is key. By incorporating vaccines, barriers, regular testing, and open communication, you can protect yourself and your partner without missing out on the fun. Here's a simple 4-week action plan. Week 1, schedule an STI test and dental checkup. Week 2, talk to your doc about the HPV vaccine. Week 3, stock up on barriers like dental dams. Week 4, track how you feel and adjust. Remember, this isn't medical advice. Always consult your healthcare provider, especially if you have chronic conditions. If you found this helpful, hit that subscribe button for more weekly tips on sexual health for men over 65. Comment below. Which risk surprised you most? Or what's one tip you'll try first? Share this video with a buddy. Knowledge is power. Age is just a number, and with the right steps, you can keep thriving. Stay strong, gentlemen. See you next time.